So we've gone just a little bit into our Q&A time. So if you have questions, please get your hands up as quick as you can. I've got a question right up here in the front with Lysanthia. No questions, Lysanthia.
Mark, first of all, I'd love to compliment you on your use of a prop. So your beard is incredibly engaging.
Oh, really?
As an audience member, I suggest you do this always.
Okay.
Never present without your glitter.
That's awesome.
So you mentioned two really important things. You mentioned burnout, and you mentioned the need for empathy.
Yeah.
I wonder if you might speak to the relationship that might happen in terms of compassion fatigue and the relationship that might exist between those two things, and perhaps from your own experience, some self-preservation strategies.
Yeah. It's a great question. So did everyone hear that question and understand the question? Compassion fatigue is really about when you give yourself too much, that you then become a little bit hardened to their experience. My experience in this, and it's happened over the course of my clinical time, is that I've had to be able to separate myself from patient care. Separating yourself, because when I was a young, immature therapist, I brought my patients home with me. Right? I would have dreams about what I did in the clinic and if it was appropriate or not. Or not inappropriate, you know what I'm saying? Like, was it a good treatment? Was it a good treatment? Right? Did I do the best that I could do for that patient? Or what did I miss? I always feared that I was going to miss something. And I really fatigued, I was emotionally drained. But then there's techniques and there's ways that you can kind of clear your space of patients and separate yourself from patient care. I do a lot of mindfulness and meditation actually in order to kind of separate the two things from how I manage my day. And I set the intentions of what I'm going to do, and then I close the intentions after my clinical time in order for me to separate from my patients. And I know that sounds pretty heady, right? It sounds a little esoteric, right? Is setting the intentions and separating yourself, but there's something to that. When you can put your work and leave your work at work and then focus on you and your time, it makes a huge difference in your ability to show up for patient care. Also, exercise. Exercise to me is a way for me to get my endorphin release and also allow myself to process things. I do a lot of processing on the bike. I do a lot of thinking, but it allows me to process through things and let a lot of stuff go. So does that answer your question? Yeah, awesome.
We had another question right here.
Yeah, Jody.
Just a couple rows back. Mic 2.
Mic check.
Jody, try talk. Thanks. Okay.
Mark, thank you very much for bringing this. This has really been helpful.
Awesome.
I'm noticing on my lean-in, I'm like blowing people away with information, and how do I dose that? I'm pretty new in pain science, but I have a lot to share.
Yes.
And I think I'm just killing people.
Yeah. That is, first I'd like to thank you for acknowledging that, right? I mean, that's a big step for you, because I've had therapists that are like, I'm not telling them too much, and then I videotape them. And I'm like, wow, look at what you just told them. You talked for 12 minutes, right? So that's one way. You can videotape yourself, right? To actually give yourself some feedback. In my fellowship training, there's a few other in here that you have to videotape yourself on many exams and many patient interactions, and that's one of the most telling ways to see what you're doing is by watching yourself. Secondly, you have to be okay with dosed information. Just like exercise, information about pain and about that entire subject needs to be dosed just like you would any other intervention. And it takes time to develop the narrative that you need to develop, but you have to find, oh man, it's difficult because every patient has a different tolerance for knowledge, a different depth of understanding, and a different receptive part as well of what they're willing and able to tolerate and want to tolerate. And so being a patient judge, a judgment of that patient is extremely important and comes with just knowing and time and experience. I think one of the things you can do is you can write down a limit of what you can talk about the first time, right? Just like you have 5 or 6 main points that have to happen that first visit, right? You have to give them this information that you know is going to be most impactful for their whole course of care, right? And also just shutting up. Seriously. It's really hard because you really want to get all that information to them. And verbal diarrhea, even if it's positive, can be overwhelming to that patient. Does anybody else have any suggestions on that, on how they've kind of been able to rein themselves in and not throwing up on patients? Because this is a tough one. Got one over here?
I was enlightened by one client who came in with an acute spasm, and I was trying. Oh, I'm sorry. Okay. I was enlightened by a client who came in with an acute spasm, and she was in a lot of pain. And I was trying to tell her all this stuff, and she barked at me, "I don't want to hear this. I just want to feel better." And at that moment, I was enlightened.
Fair enough.
And it taught me to just, in really listening to the client, I was able to start tuning into, like what you're saying, what body of knowledge did they come in, how much did they want to know. And some people, I was afraid to admit this at first, I didn't give them any of this because it seemed to me pretty clear that they weren't going to do anything with it, and so it was more important for me to understand it than for them.
Yeah, totally. Yeah, you can actually...
And that doesn't mean I didn't tell people, but just I started paying attention and letting them kind of gauge it.
Right, your knowledge and how you interact with that patient is treatment, and how you communicate and what you communicate is treatment. So being able to not say things that sometimes is extremely important. I think we had one more person who wanted to give a shout out back there.
Yep, in the back corner, there's a gentleman standing up.
Yeah.
Last question.
No, this was actual a comment to your question. If there was, so the way that I usually approach it is that I'll let clients, someone comes in a lot of pain, then I won't go right into discussing what I know about it, but maybe give them tools and drop that pain level just a little bit, and then they get excited about that, and then I tell them, I try to explain what I know about that mechanism so that they have it, so that they're not lectured to.
Right, yeah, that's a perfect example of show them the money, right? Show them what they're there for, and then communicate afterwards.